Fmge solution part 3. So topic for nose and paranasal sinus. So start a MCQ. Most common symptoms of nasopharyngeal cancer is neck swelling, continuous watering discharge from the node after trauma. If trauma in history, and continue water discharge from the neck or the nose, then most likely feature of the CSF rhinorrhea. After a head trauma, patient is unable to smell coffee and aseptotidia, but can smell ammonia. Which of the following statement is true about the patient? Ammonia irritant trigeminal nerve is the answer. Then a male trauma patient admitted was to a hospital with a watery discharge from the nose. Then history is the trauma and watery discharge from the nose. On investigation, so damage the creviform plate. What is the possible diagnosis? Possible diagnosis is the CSF rhinorrhea. Young operation is done in atrophic rhinitis. Then direct branch of internal carotid artery in Kesselbach plexus. Direct branch of internal carotid artery in Kesselbach plexus. Internal carotid artery को posterior ethmoid artery and anterior ethmoid artery. In option, anterior ethmoidal artery is the Samter tried included aspirin sensitivity, asthma and nasal polyp. Which of the following is the best prevention of rhinitis medicamentosa? Nasal drop withdrawal is the best to prevent rhinitis medicamentosa. Which of the most common cancer of the paranasal sinus? Squamous cell cancer is the most common cancer of paranasal sinus. Sphenoid sinus open into superior meatus, inferior meatus not, middle meatus not, supreme meatus. Sphenoidal sinus open into supreme meatus. Location of nasolacrimal duct is middle meatus not, sphenoethmoidal recess not, superior meatus not, inferior meatus. Location of the nasolacrimal duct is the inferior meatus. Nasolacrimal duct open into middle meatus of nose. Endoconal polyp open in which meatus? Middle meatus. Which of the likely source of infection for pus from the sphenoethmoidal recess? Sphenoid sinus. Which sinus open in inferior meatus? Inferior meatus is no opening in any sinus, so answer is none. Kesselbach plexus does not involve superior labial artery involve, does not involve, no. So superior labial artery involve, so is not a answer. Anterior ethmoidal artery is involved. Greater palatine artery is involved in castle base plexus. So which artery is not involved? Posterior ethmoidal artery is the not involved in castle base plexus. Which of the following is the vessels of the little area is not a branch of the external carotid artery? Which of the little area is not a branch of the external carotid artery? The internal carotid artery branch are anterior ethmoidal artery and posterior ethmoidal artery. So which one is the answer? Anterior ethmoidal artery. Which of the following is not a etiological derived from causes of epistaxis? Which of the following is not an etiological derived? Nose picking is the etiological factor. Intranasal tumor is also etiological factor. Vascular disorder of the blood dyschariasis. Vascular disorder of blood dyschariasis. So it's a etiological factor. So which one is the not a etiological factor? Hereditary hemorrhagic telangiectasia is the not a etiological derived cause for epistaxis. So answer is the D. Ethnosinoneural blastoma arises from the olfactory epithelium. All of the following are the paranasal sinuses are present at birth except sphenoidal and frontal sinus are not present at birth. So frontal sinus present at 6 years and sphenoidal present at 15 years. So which one is the answer? Sphenoid. Sinus absent at birth. Absent at birth is the sphenoid and frontal. So answer is the frontal. Radiological evidence of the frontal sinus can be seen in the sinus. And sphenoid sinus reaches adult size is the 15 years. Ethmoid sinus reached adult in the 12 years. Largest sinus is the maxillary sinus. Caldwell-Luke operation is done for maxillary sinusitis. Young operation is done for the atrophic rhinitis. Which one of the following is the causes nasal obstruction in atrophic rhinitis? Atrophic rhinitis is crusting. Crusting is the causes of nasal obstruction in atrophic rhinitis. Which of the following is the most common presentation of nasopharyngeal carcinoma? Neck swelling and lymphadenopathy. Michel's and Russell body upon biopsy is seen in the rhinoscleroma. Rhinophyma is associated which of the following hypertrophy of sebaceous gland? Causes of the rhinosporidiosis is protozoa. A patient present to you with a big nasal cavity, thick crust formation and woody hard external nose. What is the probable diagnosis? If atrophic rhinitis with woody hard external nose. So think diagnosis is the rhinoscleroma. Atrophic rhinitis is the crust formation and big nasal cavity. So answer is the rhinoscleroma. Woody induration of rhinoscleroma is initially seen at which stage? Granulomatous stage. Rhinoscleroma is caused by the bacteria. Most common feature of bone of face. Most common fracture bone on face is the nasal bone. Chevrolet fracture of nasal sputum. Chevrolet fracture of nasal sputum is the vertical fracture. Impact of force in case of the Jarjarve septal fracture is from the front. Most common site of fracture of mandible is the neck of condyle. A patient presented with 3-day history of fever, thoracic pain, difficulty in regulation with deviation of uvula. If deviation of uvula given in question, then think quinsy. Hypoglossal nerve supply all of these muscles except if the hypoglossal nerve supply in styloglossus, hyoglossus and geniglossus. So platyglossus is except not supply hypoglossal nerve. So answer is platyglossus. Piquet Fenence fever is seen in lateral sinus of thrombophlebitis. Which of the following is the not a pre-malignant lesion of condition? Which chronic hypertrophy pre-malignant condition? Chronic hypertrophic candidiasis is the pre-malignant condition, and oral submucosal fibrosis is the pre-malignant condition. Lichen planus is the pre-malignant condition. Apostos ulcer is the not a pre-malignant lesion. Treatment of nasopharyngeal carcinoma is the chemoradiation. All of the following is seen in superior laryngeal nerve. Is all of the following seen in when superior laryngeal nerve is damaged except aspiration. C. Stridor, loss of pitch, bowed vocal cord is seen when superior laryngeal nerve damage. Aspiration not seen when superior laryngeal nerve damage. Recurrent laryngeal nerve supply all except the recurrent laryngeal nerve supply in the interarytenoid, cricoarytenoid, cricothyroid, ariepicolotic not supplied by the recurrent laryngeal nerve. Most common site of the laryngeal wave is glottic level. A 15-year-old boy presenting in the history of the fever since 2 days, unable to swallow food, muffled voice, and on examination the right tonsil is shifted to the midline. So tonsil shifted to the midline, मतलब tonsil deviated. So think quinsy. Juvenile recurrent laryngeal papillomatosis is caused by the human papilloma virus. 60-year-old man presenting the right side ear pain and dysphagia. So if in ear pain and dysphagia and old age, then we think diagnosis is the carcinoma of pyriform sinus. Passavant disease is formed by the Platopharynges. Omega-shaped glottis is seen in the laryngomalacia. So answer is the laryngomalacia. Peritonsillar abscess management is the if peritonsillar abscess. If abscess, then drainage, and if infection, then given antibiotic. If pain, then analgesic. So analgesic with antibiotic and drainage. Elective tracheostomy is done in elective tracheostomy is done in the burn of head and neck. High tracheostomy done in the carcinoma of larynx. Singer present with the sore thorax, gastroesophageal reflux disease and vocal nodule. Then medical treatment is the if singer, then voice therapy and GARD. So drugs given proton pump inhibitor. So medical treatment is the speech therapy with proton pump inhibitor. Narrowest part of the glottic in pediatric age group. In pediatric age group is the lower part of the thyroid cartilage. Head and neck tumor stage 3 according to TNM stage. Classification involved is the head and neck tumor stage 3 according to the TNM stage. Classification involved answer is the bilateral mobile lymph node more than 6. Abductor of vocal cord is the abductor muscles of vocal cord is the posterior cricoarytenoid. Mouse nibbled vocal cord seen in laryngeal TB. Mouse nibbled vocal cord seen in the laryngeal TB. Hot potato voice seen in peritonsillar abscess. Narrowest part of the airway in child is the subglottis. Nasopharyngeal angiofibroma is most commonly seen in young male. A 30 years old child presents 3 years history of the gradual swelling of maxilla, medial displacement of turbinate with mild proptosis. What is the most likely diagnosis? If proptosis and displacement of the medial turbinate and maxillary swelling, think in age 13 years old, we think angiofibroma. Crypts are seen in tonsil. Malampati score is done assessing the oral cavity patient of the intubation. Which of the following muscles is not supplied by the recurrent laryngeal nerve? Posterior cricoarytenoid. Which of the following muscles is not supplied by the recurrent laryngeal nerve is the posterior cricoarytenoid. Which one of the following is the an abductor vocal cord? Which one of the following is the an abductor of vocal cord? Posterior cricoarytenoid. Recurrent laryngeal nerve supply all except recurrent laryngeal nerve supply in posterior cricoarytenoid, thyroarytenoid, lateral cricoarytenoid, cricothyroid is the not supply recurrent laryngeal nerve. So answer is the cricothyroid. Warthin tumor is seen in the parotid gland. Glossopharyngeal nerve supply in stylopharyngeus muscles. Omega shaped epiglottis seen in the laryngomalacia. Thumb sign seen in the acute epiglottis. Basalt abscess is in relation to the sternocleidomastoid muscles. Which of the following site represent the location of basalt abscess? Sternocleidomastoid muscles. All of the complication of tonsillitis except otitis media is the complication, abscess is the complication, malignant change is the not a complication. So answer is this. Sub-acute bacterial enteritis is also complication. So answer is the malignant change. Which of the following cyst does not move upon deglutition? Sublingual dermate cyst does not move upon the deglutition. In early stage of which of the following carcinoma no lymphatic involved? Glottic carcinoma no involve the lymphatic. Radiation therapy is mostly useful for epiglottis carcinoma. Hot potato voice seen in all except hot potato seen in quinsy, carcinoma of tonsil and pharyngitis. In carcinoma of thyroid, hot potato voice not seen. So answer is the carcinoma of the thyroid. Transillumination test positive seen in the ranula. Male patient with female like voice, this condition is called the puerphonia. Female patient with male like voice, type of thyroplasty is the Doni the 4. In a patient with vocal cord paralysis, the surgeon is afraid of aspiration. Thyroplasty done in order of prevent aspiration. So answer is the type 1. Most common complication of tracheostomy is the hemorrhage. Best of luck for MCI exam or FMC exam. Thank you.